Hi, everybody. Welcome to this very interesting and informative discussion around mental health and uh, pretty much everything around behavioral psychology. I have very privileged to have with me Dr. Girish Babu. He's the director, one of the directors of Manoshanti, and he will be with us when we'll have a very freewheeling discussion around everything mental health, behavioral psychology, and uh, around around uh, mental conditioning and how to really cope with if you're facing an issue around mental health. Dr. Girish is an acknowledged expert in the field. Welcome, Dr. Girish. It's a pleasure having you here.
Thank you, Ketan.
So let's start with Dr. Girish. I know you've got decades of experience in this field. So why don't you uh, provide a short introduction about yourself to the audience?
Yes, thank you, Ketan. I think to look back, I think it's been 2 decades into mental health. Basically into psychiatry. So after completing my MBBS in JSS Medical College, Mysore, I was able to get into uh, psychiatry training in NIMANS, Bangalore, which was one of the prestigious or continues to be one of the prestigious institutions in the country. And I've had a share of good exposure to various mental health conditions. Primarily, to begin with, NIMANS offered us a good share of individuals or persons with severe mental illness, which includes people with schizophrenia, bipolar. And once we completed our medical training, I was there, psychiatric training, I was there for another 3 years as senior resident, where it did give us a lot of exposure in women's mental health because I was associated with the perinatal clinic. It's basically a clinic which cater to women and child, and basically women with mental health issues during pregnancy, postpartum. And so that set the tone. And then subsequently after that, I've been working for a good 12 years in a medical college setup in SDM Medical College, Dharwad, which is a premier private institution. And it gave me a good platform to understand that I've moved from severe mental illness to a entity called common mental illness, which is much more bigger and larger than what we assume. And I worked there, and then I became a professor, and I was involved with a lot of teaching, training, and also a lot of clinical work. So it's here where I believe that training and learning both should happen together. So subsequently, in the last 2.5 years, I've moved out of the medical college training, and then we have started with the Manoshanti clinics. And I am taking care of Hubli and Dharwad. And one of the things which I do or I have been able to understand is mental health per se has its own unique issues, and it should be not just in the medical setups, it should be having its own presence, because I think there is a lot of stigma associated with people reaching out to us. One, because largely the beliefs are held because of what we believed about mental health being equated to severe mental illness, which is around 1 to 2% of the larger population. When we look at the larger or a common issue is common health issues, which includes anxiety, depression, which is kind of a occurs for 10 to 20%. It's almost every fourth individual have some mental health issues in their lifetime. So it's just that with time we realize that there is a need to have a space where we cater to the common mental health issues, which is having its own identity, and people can come take help. And so that's the whole idea with which Manoshanti clinics were initiated. Also, what I realized with my training and learning the last from 2005 till now is that it's one area where we are dealing with the most sensitive aspect of a human being, that's the mind. And probably it's I think the however it is it's one of the most sensible and sensitive domain where we need to be very passionate. Also, we should be equipped with skills to engage with people, help them to manage their mental health concerns, which may be as personal as their own emotional difficulties about themselves. to their relationships, to the issues at workspace. So there are various domains where we come across, and so that's where I think now the last 2 years we've been quite active, and we've been able to pursue in a way where we believed, and I think we've been also joined by I think our other batchmates, Dr. Narendra and Rishikesh. I think three of us were together, and I think we all had our own styles of practices, but we had common theme that we should take mental health as one of the most important aspect for individuals to consider on a day-to-day basis, like how we look at other physical health aspects. So it's like we need to pay attention, and that will set the tone for the day and then the future. So this is a brief intro. So this is about myself.
That's such a fascinating journey, and I think you raised very important points around mental health, uh, being a stigma, and I think I think it's very important that we bring it to the notice of everyone that it's okay to reach out, and I think that's one of the objectives of trying to reach out to the larger audience and ensuring that they it's just like for heart condition or for diabetes, right? That those symptoms are pretty aware, but mental health sometimes people are not aware. And you raised very important points. I think that's makes a lot of difference when So a follow-up to that question. So how do would you describe your approach to treatment? I think now that you have kind of raised the issues around mental health and how you uh, came into this field and what Manoshanti does, but what is your approach to you know treatment, and also what do you think makes an effective therapeutic alliance with a prospective patient who comes to you?
Yeah, I mean, I think that's a very good question what you've asked when it comes to how do I approach, and even we reflect the same in our clinics, that is Manoshanti clinics. One of the key areas is we have to be sensitive from the time they reach out to us, maybe the front desk to sitting and consulting at our clinic. So one thing we have really changed or we have looked at is, I think the first consultation is the key where we give them adequate time, and it certainly helps us in terms of encouraging them to really express themselves. I think that's the first thing, and we try to engage, we try to understand their feelings. Also, that's the where the question of empathy comes into picture. I mean, that's where we are really geared towards ourselves and also the team we are working with. So it's not just me sitting inside the clinic and talking, but it's the whole setups which are driven towards being more empathetic towards individuals which are with mental health issues. The main concerns what we see is people with physical illness is visible. Mental health issues are invisible. So a lot of times it takes a good toll on individuals to make others believe that this is something which is true what they are experiencing. So this is one area where we give ample time and attention to each individual who come to us and help them to understand their feelings. And then in the process, we are also helping them to see how we can improve them with various measures. I mean, initially we've been using medications and various treatments, but now we have understood that treatment with medications alone may not be sufficient. We need to look at and add in terms of counseling, psychotherapy, and then various other measure methods like brain stimulation methods like RTMS, magnetic stimulation. Then we have also other cognitive retraining. So there are other training and methods where we can help individuals recover from their mental health issues. And also we want to bring in that we are clearly driven by science, in the sense we also see what works, and it's not something because I believe it works. It's also something we have backed by the data across the world, and so it's a kind of place where we offer patients the best possible treatment methods which have the best evidence. And the other option, so we have, in simple terms, we have most of the treatments available across the world in Manoshanti and the recent whatever. So that is one. Also, we are very ethical in our approach where we involve the patients. We'll help them to take an informed decision about their treatment methods, and we involve the family to engage. And eventually, it's a holistic effort towards engaging the family in their well-being, engaging the individual in their own recovery and well-being. So this is where we bring in. So in one single snapshot, if you ask me to mention, it is about uh, giving them ample space to express themselves and help them in their recovery. And we offer them, these are the measures which we have, methods we have. So that is how, and then we bring in all the stakeholders in the process of treatment.
Yeah, I think that's great. I think just a follow-up to that question. So you spoke about you know uh, how Manoshanti and you personally approach your clinical diagnosis and help them through the recovery. So, what makes Manoshanti unique in the mental health care ecosystem? There are it's a very crowded ecosystem. There are a lot of other players, but what makes you unique? And also, what do you think the patients also appreciate most about your team and environment, which
Yeah, man.
makes you successful?
One important thing a lot of patients have given feedback is our clinics, Manoshanti clinics, does not typically look like a hospital. It's like a center where people feel better the moment they enter. So it's a kind of a environment we have created so that it's not a very typical hospital setups where people come with problems. And so it's a center where the moment they walk in, they should feel better. There's a degree of calmness which is probably not just the infrastructure, it is also the people around. We engage, we train and involve them. Second, we also have having our own systems and processes in the patient care. So we make sure we do not rush through every patient who walks in, be it from any corner, be it from any socioeconomic strata. So we ensure that they get adequate time and their problems are well understood. That's the key important thing. The third thing which I do understand there's a crowded space, but we have a tier two presence. I think I see a lot of startups which are there, which are largely in the metros, and largely because that's the financial model where it works there, and there is also a lot of openness to reach out to psychiatrists and mental health professionals. Our centers are geared towards not just metros, we are into or expanding in tier two cities. So to begin with, I think we have a centers in Hubli and Dharwad, and now we have started in Mysore. So we are looking at adding more centers in tier two centers because we also feel there is a need of mental health across. It's not just about metros. The problems are not limited to metro. The problems are different in metros. Problems are different in tier two, tier three cities. So that's the other unique positioning what we have. And yeah, I mean, so that is one which I think I would like to highlight with our setups.
That's interesting. I just wanted to for you to go into a little more detail on. You mentioned that you don't have a hospital setup, right? And that's important because I think that resonates a little. So, in terms of what exactly do you do, or what have you done to ensure that you don't have hospital-like experience? You said that uh, it's very much cool. It's very much more an environment where people are relaxed. So what exactly have you done in terms of ensuring that? And second, also another point you mentioned about tier two and tier one, right? I think yes, tier two is a very underserved, and that's an area where definitely a lot of latent demand is there. Of course, metros are a little more, major metros, people are a little more at least aware, and they're not shy to approach. But of course, tier two is where, and I appreciate the fact that you're trying to tap into that market. But what do you see are the major differences between tier one, tier two, and what are the common concerns that your patients come to you with? So just a couple of questions. So what makes your setup different, which you said is your strength, and the profile of your audience, of what exactly are the differences between tier one, tier two, and what are the main common concerns that they usually come with?
So the first thing I think to give you an analogy about how our centers are a little different from the other hospitals, you just take we cater to children, and a lot of kids come in here for trainings, and none of the kids feel scared about getting into Manoshanti clinics. That's one thing. So we are very conscious about avoiding giving them any injections in the clinic. So it's as simple as that. So end of the day, there are no painful procedures which are there across. Be it kids, even with adults, what we do is, I think a lot of times uh, we look at individuals rather than problems. So when people come to us, we just don't look at the problems, because what happens is, with time, because time itself is a very uh, limited resource, when we have the numbers being more across any branches, specialities, or anywhere, we get into the problem and exit, and we leave the individual to fend for himself. Meaning, there is this uh, problem-based approach without really encompassing the individual and the context of the individual's issues. We look at it the other way around. We get into the individual, get to know his context, and then get into the problem, so that it helps us to make him feel that he is being completely understood. So that's the key when it comes to adult. And there are individuals where they have their own difficulties to understand the problems, where the family gets in. Even there, I think the idea is we get to talk to them, get to understand what is that they or he thinks, or why is that he's been brought to the hospital. So essentially, patient first. I mean, that's, or the one who's brought, one with the problem is the first. That's the idea. That's where I think we cater to the core issue. Plus, the centers are relatively calmer. We do not have any clutter anywhere. We do not have any noise, so noise levels are less, the clutters are less. We also follow this system where we give appointments where we don't really crowd the patients. We do not want that to happen, because a lot of times patients feel quite restless waiting for the doctor because of their inherent kind of issues what they have. So there we also get into the system. We have been trying to create a system for ourselves where patients are aware what time to come, we are aware what time to come. We all follow these in principle, and so that the clinic's relatively relaxed all the time. So you walk in, you don't feel it's rush. So basically that's the idea. And then we walk in, we don't rush through the patient. That's the other thing. The patients feel comfortable because we are seeing them for a good amount of time. And so everything is clearly trying to make it a little organized, and it's working well in metros and these bigger places. In tier 2 cities, it is taking time, because the mindset of the people also need to get used to. People who recognize the benefits are slowly falling in line, and they're quite comfortable that we call them at a particular time, and we see them. People from all strata, including people from lower strata, they, okay, I don't need to wait for the doctor. I don't need to wait for the whole day to see this doctor. We give them time. He comes in, we see him, talk to him, this is what it is, and then we initiate the treatment process. They again come back at a particular time, and so everything is predictable. So that's the other thing which we are trying to make it. So predictability is something which we are trying to bring into the system in place. And with all these things, we also have prepared our staff who are there to cater to the issues. So it's like it's their own problems, or we feel patient's problem needs to be understood like as our problem, and everybody is aware. Okay, we need to see how we can address the issues. So this is where we are taking steps towards the future.
Great. I mean, I really appreciate the fact that so much of detailing, right, in terms of every aspect of what you just mentioned, right, right from the setup to the way you interact, and then of course the way you kind of diagnose. And I think, I think that's the key thing, right? Understanding that the patient is here, that the fact that the patient has come to you itself is a big step, right? And then you take it from there. And I think that's very important points that you mentioned. Now, another thing is, so what can a patient expect in your first session with you, right? Irrespective, of course, it depends on the condition and, the age and multiple factors are there, parameters are there. But first session, how does the first session look like? How do you make them, comfortable? And also, uh, apart from the patient, the family or the close near or dear ones who are also as affected because of the conditions, uh, you know it could be directly or indirectly affected. How do you take them in also into confidence? Because the ecosystem around the patient is also very important
Yeah,
in getting them to recover as well. So yeah, how do you kind of
that's a
take
very good
everybody
point
into
what you raised. I think the first interview is the most important interaction with the patient, and it's a make or a break. Meaning, you will also understand whether the patient will come back to you or not. That's the most important decision what he takes or she takes when he goes back. So Keeping that in mind, we have very clearly earmarked a good amount of time when the patient walks in. So we have dedicated time. So that's one. Second, we also engage with the person with problems, that is the index person who has come for the problem, or sometimes it's the couple with marital issues. Then we interview both of them together. So, and then we call the family members. So it's essentially a interview process where we try to elicit the concerns what they have, the patient and then the family, and then put everything into perspectives and give them an option, give them a feedback about what are the kind of issues. And we also offer them a kind of an extended step of understanding where we do get detailed assessment in terms of their, if a child is brought into, we need to evaluate for intellectual functioning to learning difficulties are there, or depending on the kind of problem of child comes, or if an adult comes, then we look at the degree of the difficulty. We try to give them a feedback using various tools what we have in psychiatry, scales and various assessments, and then that will also make them understand, okay, it's not just one individual, it's a team who is looking into. So it's not like so we are trying to work towards creating a system where the doctor sees, the clinicians, the psychologist will understand and give a feedback. So there's multiple informations which we collect and then give them a feedback. And then we take up steps. Okay, you need to take these. These are the available options which are there in terms of treatment methods. We have therapy, counseling, we have medications, we have other methods. And depending on the individual's needs, we offer it to them. And there are a lot of myths about mental health issues, about medications. We try to address them in the first sitting or whenever they bring it up, because I think that's where it also makes them feel a little comfortable, because it's also about not just first visit, it's also about the same continued sustained follow-ups will be there, where we engage with the similar interest and attention. So I think that's where we look at and continue to see how we can help them to solve problems. Eventually, the goal is to help them to recover from the problem, identify the problem, help them with the available solutions, and then move towards recovery. That is where we eventually help them to, even a lot of patients who've been on multiple medications, we've been able to help them. Okay, look, I mean, you need medicines. What is the available required dose? We'll try to see if we can minimize. And then we also bring in other methods to help them to take care of their emotional well-being. That is where we eventually help them to recover. And then a lot of times, complete recovery is where we all believe that whether we can get rid of medicines. There is always a hope that people feel, okay, if we can get rid of medicines, I feel I'm all right. So we even try to get the patients to reach that state, and then, okay, we will give you a period of drug-free period. Try it out and ensure that you engage with us even after discontinuing medications. But you need to do well. So we keep options open. We align with the individuals who come to us and engage them. And then a lot of times they're quite happy. There are some set of patients who would require continued medications. We tell them, look, I mean, the kind of problem what we are dealing with may be required to have medicines. And we also address them, what are the adverse effects, side effects, how do we monitor for those. So we take every finer aspects, nuances, so that their journey with us is kind of a more engaging, and they will be empowered towards recovery. So that's the kind of a thing. So maybe for 3 to 6 months, sometimes 3 to 5 years, depending on the kind of problem what we see, we need to be with them for that period of time. So we have that in mind, and the whole we are trying to slowly, or we have already built the processes in place which are helping us to engage with the patient with this.
It's just amazing. I mean, there's so much of depth there. Uh, Now, the important question is, we have understood right from the first step to the way you approach, the way you diagnose, the way you confide and build trust with the patient. Everything we have covered. But now, fundamental question is, when should someone actually seek help, right? When do you think uh, it's you feel that a patient should think, okay, now I think I need to check with a mental health professional. The headache I'm facing, or it could be, I mean, mostly the manifestations are more physical, right? It could be gastrointestinal problems, it could be headaches, normal headaches, or stress, or things that fever or cough. basically physical manifestations which people will seek a normal general practitioner or a specialist, ENT specialist, for example. But they don't go to a mental health professional. When do you think, right, they should actually seek help with a mental health professional? Or do you think that it's only that another doctor who recommends that, okay, let's do a, a secondary diagnosis with a mental health professional? Do you think that is the path that happens, or generally people, when do you see them approaching saying, okay, now I need help? And also, how does and what are the things that you need to, what do you look at when you're talking to it, that you see triggers that no, this person needs care, help?
It's a very good question. I think the key point is, when do I think I need to reach out to a professional to when it comes to mental health? This is a very good question, because a lot of times when it comes to headache, when it comes to fever, it's well understood. I think 1 or 2 days of fever, it's not settling down, then people reach out to a physician or a local family physician. See, when it comes to mental health, I think the key thing is when somebody is not able to maintain their emotional well-being. When I say emotional well-being, it is about their ability to pay attention to the tasks which are there in their hands, be it at work, be it in their relationships, be it at school and college when people are studying population. So when we are unable to pay attention, so that's the key area where we see that a lot of emotional problems leads to impaired attention and concentration. So directly it affects them in terms of they make a lot of errors in their workspace or in their school and colleges. There are problems in the relationship because they're easily getting upset with each other, because they're not really aware what is happening with each other person with whom they live. So this is one of the area where if somebody is persistingly not able to pay attention, do their tasks, I think that's the time where we need to see why and what. And mental health professionals are the right kind of person who will really evaluate the primary problems in these individuals, attentional difficulties, be it ADHD, which is in children and young adults, or be it the common emotional disorders in the form of anxiety and depression, which leads to this attentional impairment. The second important thing which I see is, which can be identified, is an individual is unable to rest and relax. And the best time, I think we all have to sleep for 6 to 8 hours. There's no real second thought about it, be it anywhere, any part of the world. And so that's the required time and state of mind which helps us to get back and start a journey for the whole day. So if somebody is unable to get sleep adequately, or able to, or gets up very early and sleep it's significantly disturbed, that's also the thing which needs to alert them. Okay, I'm not able to sleep for more than a week to 10 2 weeks or a long period. Then I think it's worthwhile reaching out, because we need to address that. We just cannot leave it, because if you leave it later, it becomes one of those primary cause for having somebody developing hypertension, diabetes, medical issues, a lot of impairment in their environment. So that's the second thing. Third thing, if somebody is not really feeling good about themselves, not having an adequate energy throughout the day, feel low for no reasons, or sometimes they react very quickly for things around and get upset, which affects their relationships, or even not able to execute their uh, journey to day-to-day activities too. So the emotional state where it should be relatively comfortable, where we are able to uh, adapt to various situations, meaning you are in a traffic and you should be able to sustain the traffic, and there is a diversion which is happening, we should be able to navigate that. But it should not reach to a point where you get into a fight with the people around. So if it's an ongoing thing on a daily basis, then I think it's time for the individual to reach out. So what happens is, the mental health is also a symptom or a sign of the physical. I mean, it's a functioning part of the brain. Mind is not something which is an external entity. It's a functional part of the brain. So a large part of it, 70 to 80% of it, is because of the brain networking, brain impaired functioning in the brain, the chemicals being impaired, or the release is not adequate. The stress hormones are working at a very high levels. So that needs to be rectified. If we just do not do only changing the environment, we do get some results, but it's not going to be a sustained result. That is one area where we need to reach out to our professionals, and probably the mental health professionals with a medical background would be the ideal set of people whom people should. That is MBBS, post MBBS. We've had a training of psychiatric training, so it gives a lot of idea about we get a holistic physical plus the psychological and emotional. We look into everything together and see. That is where I think we need to reach out. And when there is a problem which is sustained over more than weeks together, we need to reach out. Sometimes when problems are very alarming, very severe, like somebody experiencing a panic attack, I don't think so. We need to make him to wait for a longer period because that drives them crazy, and then they go to a physician, go to a gastroenterologist, like what you said. So I think that's also where they can early reach out to a psychiatrist and see what is happening. I mean, they can always say that, okay, this is what is happening and discuss about the various aspects. I mean, a lot of times they get scared whether they'll be put on medications. I don't think so because, yeah, I mean, so that's the position what we are looking at. We are not somebody who are trying to push medications alone. We are trying to understand, try to help them whatever available best methods of treatment will offer them and they can take it up for. So that's the other side where we need to look at. So these are very core basic things. And then again, sometimes when stress is taking a toll, when there's a constant stress over a period of time, there's something called burnout. For me, if you, from a clinical point, from a medical point, what burnout is nothing but a sign of depression. Somebody is experiencing depression. Burnout is absence of energy, the drive loses, we feel tired, we just cannot work through. So that's also the time where I think somebody can address by addressing the anxiety or ongoing stress. That is best so that we prevent somebody getting into burnout. Somebody is experiencing burnout should immediately reach out to us. That's the other side. So those are a few things. And when we look at a little more, I think people who are experiencing negative thoughts in the form of having self-injurious thoughts or there's no, I mean, the kind of suicidal thoughts. I think any sign if somebody is experiencing a suicidal thought at any point of time, they need to reach out to a psychiatrist because it's as good as somebody is having a headache with a tumor inside because it can end up severely anytime. Once in a while, occasionally, I can understand, but if it's becoming a recurring thought, we need to help them out of it. It's a kind of a disease state of mind, and we have measures to help them out, medications, counseling. So that's the other area where we need to make people aware. Like that, we have other issues in terms of children. We have certain issues, learning related difficulties. They have difficulty connecting with other kids and the elders. And elderly, we have specifically issues related to memory loss early. So there are, depending on the age group, we have different set of symptoms where they should reach out to a psychiatrist
I think
or
that's
next.
very, very, you know, eye-opening. It's really like a bulb-on moment in terms of the depth, like I said, and the kind of I was as I was listening, I was not aware of, what is happening in the world outside, that there's so many things to consider, and I think that you're absolutely right. I think symptoms are different, but the underlying disease could be a little different. So I think really put that very, very clearly. So just a simple question. I think it could be a one-word answer also, but just to follow up on your previous answer, do patients reach out more to you individually because they say, okay, now I need to reach out, or do the loved ones or near or dear ones who are affected more, they reach out mostly? Who reaches out? And secondly, if you had to pick up the top three conditions, right, across, right, what are the three most important conditions? Because this is you as a mental health practitioner and a senior doctor, right? Your feedback in the market, you've been in there, you've seen hundreds and thousands of patients. What are the three most common conditions that people come to you for? So yeah, though there are
Uh,
two.
yeah. To answer your first question, I think that's a good question whether the patients come or the family pickup. So I think it's a mix we see. When it comes to younger age group, younger kids and all, the parents obviously identify the problem and come. Nowadays, adolescents to young adults, they are able to identify they have emotional issues. They come to us. So there is a little help seeking, which is definitely better than what it was earlier from our generations. When I say our generation, probably 2, 3 decades, our age group when we were 15 to 25. So compared to that, we were hesitant to reach out, but now younger generation 15 to 25, they reach out to us. And then I think the our generation, I think the loved ones get us. I think that we are still stuck in that zone where we're little reluctant to reach out to mental health professional, because I think I can manage. That's the kind of belief which we all have. And a lot of times people are not aware that it is something which needs to be addressed. And many a times they visit a gastroenterologist or a cardiologist or a neurologist because they have other physical complaints, somatic complaints. There's an underlying emotional distress, stress, but what happens is they do have pains everywhere. Then they reach out. Okay, it's easier to reach out to a physician who addresses my pain, and then obviously that is what happens. But I think when somebody's physician says that everything is normal, that's the time where they need to start thinking, why am I experiencing this? And I might need to look at my own emotional well-being. That's the time where we need to move towards. That's the first question. What I think so. It's a mix of both. And in elderly, I think it's the parents or the family members who get to them, because a lot of times, one, because of their own difficulties, that is in terms of memory difficulties, and they need help. I think that's where I think the family members get us. That's the thing. Now, the second point, when you said, no, what are the three important things which are important? For me, I think when we look at it, the first which really ranks first among all the things is the people experiencing depression, because this is one entity which is completely treatable. And if we don't treat, we end up in disasters. The reason why I'm bringing it is we have enough people who commit suicide on a day-to-day basis. I mean, we have around deaths which is equating to road traffic accidents when it comes to comparing the age group of 15 to 25 or 30. You see that prime age people who are engaging with going through emotional distress and completed suicides is quite high, and unfortunately it's pretty high in men compared to women. So there is this whole entity where we are looking at depression as one of the major clinical condition which we look at. And studies also have been constantly highlighting that the prevalence is nothing less than 10 to 15%, sometimes up to 20 to 30% in particular time zones, like women experiencing depression during postmenopause, postpartum, men during this 15 to 30, 35 years during the financial or their professional changes what they're going through. So these are the areas where I see that that's the primary focus. The second, what I would like to look at is a lot of people experience anxiety as an entity which is kind of a thing which drives them to uh, a lot of healthcare. I mean, it's like it puts its pressure, or the largely taken care by the physical uh, health setups, because they end up with cardiac health issues. I think we did have see of people, or we do see sometimes when a major film actor dies because of cardiac issues. A lot of people queue up cardiologists thinking they may have a heart attack, but it's largely an panic or an anxiety attack which would have led to them. So there's a large chunk of people who are driven like that. So depression and anxiety are the ones, because these are the ones also which define our quality of. The one, we are reaching where we are able to take care of our physical health, the basic necessities are fulfilled. And now we are also looking at how do we improve our quality of life, how do we improve our attentional space. The third entity which I see now it's increasing is the adult ADHD. I think it's becoming a little more recent. I was just discussing or looking into the US data. It says around 7 to 8% it was, and now it's become 11%. So 2 to 3% rise in a span of 5 to 10 years. It's a huge increase. Now we do have data which says that it's increasing partly because of the environmental changes, partly because of the existing of ADHD as an entity, which is in children it's around 10%. So we do see that it's there around 5 to 8% in adults, and this is where they get into problems in their workspace or even in their relationship space. I think this is where we need to look into it and that. So these are three things which I think, and depending on, again, if you ask me, if it's younger kids, there are issues which are unique. If there are elderly, cognitive issues, dementias is also, we have a growing population who are getting older. So the percentage of people having memory loss is gradually increasing, and that's another area where we have. But these are the three: depression, and then anxiety disorder, quite common, and then the adult ADHD. These are a few things which I think would be the one which I put it on par, because they have direct impact on the individuals, or the, I mean, if you look at it, the workplace loss is huge because of these issues. Absenteeism, the industry per se also suffers, not just the individual. So it's a kind of the family, industry, individual, everybody. So society per se has its impact. So this is where I think we are focusing, and then the whole idea is to help individuals to identify, help them recover, and then continue to manage themselves.
That's pretty detailed. I think that you kind of covered pretty much the entire gamut of what is required. Uh, I now that you mentioned that point, I think mindset is a problem, right? I think now that you focused on tier two, you mentioned tier two, tier three cities. You're based in a tier two town, Dharwad and Hubli, which uh, I remember a very popular actor, and this is on record. I think Nawazuddin Siddiqui was it. He said that, you know, there's nothing called as depression. It's just city based, some city awareness. Nobody in villages has depression. This was also a popular cricketer, Kapil Dev, a legend, right? He also said something around the same lines. I was just recalling. So when such popular person, and the common thing is they come from very rural, small town environment, and where the mindset is like, nothing, like it's more of a city fad. Villages, nothing happens. Small towns, it's just a pressure. We are tough enough. So the mindset is a big problem to change, right? And I think it's something which you grapple with a lot in terms of how do you change that mindset, specifically now that you have a presence in a tier two, and we all acknowledge that the problem is there. People are reaching out, a lot of today's generation, but how do you change that mindset?
It's a very good question. I mean, I think there are opinions, and I would call them as opinions. A lot of people have their own opinions, and a lot of people give opinions beyond their domain of expertise and experience. So I mean, that's very natural, because they have a fan base popularity, and then people follow them, and they believe that whatever they say is true. But I think time and again we need to rub this assumptions what we have, and we look at hard data and literature. And the Indian data, which is National Medical Health Survey, which was done in 2015, I think it clearly mentions there's a huge problem of mental health issues in men and women. Not about severe mental illness, about common mental health issues in the form of depression, anxiety, and addiction. So that's one entity which I didn't really bring it up, because a lot of times in tier 2, tier 3 cities, even in Taiwan, a lot of people get into substance because it's a stress buster. And unfortunately, it itself becomes a problem, and they reach out to us with when it's a little more severe, where they find it difficult. So the data is something which you need to rely on rather than opinions. I understand there are also people who are supporting, like Virat Kohli openly came up with his experience in depression, and I think Deepika Padukone is another person who's also talked about mental health issues. What she's been, and we have a, I think, musician, singer Raghu Dixit, who's also somebody who is quite open about his mental health struggles, which he's been through, and is also open to talk about taking help, seeking help. So I think it's always going to be there. There will be a mix of people. So what I feel is bringing in data to people, enhancing their awareness. Basically, this is where you're dealing with something which is most important for us, for everybody. Most sensitive and most important for us is how well our mind works. It's the driver of an individual for the day and for his life. So there is no second thought about it. I think what we need to understand is, till now we were all believing that it is a problem which is maybe 1 in 100 suffers, or 1 into 2, and we did think that is what is mental health. And but we are slowly seeing that we that is a separate set of people who experience severe mental illness. We are having a separate set of people who have experienced time and again a lot of ups and downs in their lives: emotional distress, attentional difficulties, substance related, addiction related issues. So when we look at this issue, I see that we cannot just deny it, but it is there in front of us. So I think it may take some time, but yeah, the that's a good question. How do you get over the stigma and then these things? I think it's a constant continued effort towards making people aware that yes, this is something which needs to be taken care, and We are there to help. The whole world is in one direction, so we need to just say that you cannot just say it is wrong. It's something which we have become aware now. It's like I would always go back and look at how when Copernicus came up with the telescope, I think till then we all believed that the Earth is in the center and the Earth, Sun, and Moon and everything is running around. So when we get a little additional tool or a method to make people understand a little more, probably things change. So maybe that's a thing. I think it takes time. We don't know, I mean, how, when, and what it'll, but eventually we are moving in that direction. What I feel, tied to cities, men do have problems, women do have, it's not just a problem of metros. So it's a problem which is there. Issues are a little different here, which I agree. A little different across based on the place where we live. The coast has its own issue. So that
Absolutely. I think you hit the nail on the head. I think you could have put it in a better way. I think definitely education awareness is a lot of things. And the way you spoke about how you ensure that the environment makes somebody very comfortable. All small things you mentioned throughout our discussion, details, I think those are really inspirational. One last question I had, it's more of uh, something which is more uh, related to you in terms of what motivates you most about your work, right? You're in a field where obviously it's a passion for you, but then what really is the biggest motivation do you get? And one last message for people who would like to, you would like to give to someone who's probably hesitant to reach out. You mentioned about when they should reach out, what we should do, how you take it, but still, right? What motivates you and what message to somebody who probably wants to reach out, but they're still hesitant? Just one last
yeah,
question. Wonderful. Thank you, Dr. Girish. This was really a very eye-opening discussion. It will definitely highlighting all the important points around mental health and depression, anxiety, and why we should seek help and the entire process of it. I think you went into great detail and depth, and that thanks for that. So once again, appreciate your time and look forward to having another great discussion with you, Dr. Girish. Have a great day. Thank
thank
you.
you.